Thank you. A new study just released has some surprising information when it comes to beating pain.
Health anchor Liz Bonus joins us now with how it could make a difference in opioid addiction. Liz.
Hey guys, good afternoon once again. With the addiction crisis on the rise, both primary care and emergency medicine experts are trying to reduce the number of prescriptions for opioids. Today, a new study with some new information that might help in knowing a little bit more about what actually works to help fight pain.
Over the course of the last, from May to September, we've reduced the number of opiate prescriptions out of the TriHealth emergency departments by over 30%.
Dr. Phil Oblinger is one of several emergency medicine providers already part of efforts in our community to reduce initial opioid prescriptions for pain.
Our emergency departments in the whole area are working together to develop protocols for chronic pain patients and for approach to acute pain.
Now this new study showing them that for that acute pain, they're headed down the right path. The results in this Journal of the American Medical Association study show that opioids do not necessarily bring more pain relief than other medications. The study looked at more than 400 people between the ages of 21 and 64 who came to the emergency department with an injury to an extremity, such as a broken arm. One group of patients given an opioid and acetaminophen, a combination for pain relief. The other group not given opioids, but rather a combination of ibuprofen and acetaminophen. Researchers found, when they looked at the final results, that after 2 hours, patients in both groups reported about the same reduction in pain. Specialists at the Cleveland Clinic that reviewed this study say there are more options that should be considered now. Pain management is about education for providers and patients. They also say it's important to be realistic about pain levels. Sometimes having a goal of 0 may be good short term, but not good in the long term, as people become addicted to opioids. Now, since a lot of emergency room visits involve an injury that is painful, this is critical information for patients and providers. And by the way, they don't want you to keep self-treating with more acetaminophen, once you leave. And that's the problem. People say, well, for a little while it's okay, and then, it keeps hurting for days, and after a while you can't stand it. One of the things that's important to point out is there was a 0 tolerance for pain when all this started. That was the goal, that people shouldn't be in pain, and pain isn't good for you. We may have to reevaluate that a little bit as we look at
You think?
changes.
Yeah.